Innovative medical materials are injecting new value into traditional manufacturing. Inspired by textile manufacturing, ITRI has developed bio-inspired ligament scaffold, BILS, is the result of ITRI's cross-disciplinary innovation. Ligament injuries often involve ACL tears. There are about 300,000 reconstruction surgeries performed in the US every year. Autologous tendon reconstruction uses the patient's own tissue. It often leads to pain, muscle weakness, and at least 6 months of rehabilitation. Artificial ligament transplantation may possibly rupture, cause arthritis. For patients, there has never truly been a better solution. ITRI's BILS addresses clinical challenges with 3 key advantages. First, enhanced strength. With a special woven structure reinforced with bioceramics, it strengthens the adhesion between the ligament and bone cells. After implantation, it integrates with the body's tissue, achieving a strength 3 times greater than traditional ligaments. This ensures both strength and stability. Second, upgraded safety. Conventional artificial ligaments may release the heavy metal antimony when exposed to heat. ITRI's innovation uses an antimony-free catalyst technology, eliminating long-term safety concerns. Third, faster recovery. By combining the woven structure with collagen, the scaffold promotes better cell attachment and growth. Animal studies have shown that it can reduce recovery time by 1/3. The technology has already been transferred to medical device manufacturers and textile companies, with patents secured in the US, the EU, and Japan. Looking forward, the technology will enter the global high-end medical device market, driving industrial upgrading and creating greater added value. By enhancing treatment efficiency and patient care, this innovation contributes to a better quality of life.